All right, I'd like to call the HHS meeting of May 4th to order. Roll call, please.
Chair Runningham?
Here.
Vice Chair Swarzy?
Here.
Member Selman? Member Chaplin?
Here.
Member Desart?
Here.
Member LaPlante?
Here. All right, so a quorum is not present. So under 7E OMA, members can participate virtually. Requisite officers are present at a regular meeting location. Online and in-person public comment has been provided for with health protocols in the room. So all of our votes are going to be roll call votes. Do we have any public comments?
No public comment.
Okay. So just to kind of let everybody know, as we are getting closer to the American Rescue federal funding to be received by the county, I've had the opportunity to have discussion with Vice Chair Swarzy and Mary Keating and Gina Strafford Ahmed of the CDBG. We've spoken with the United Way and also internally about the opportunity of the county to become a 2-on-1 provider, and kind of just fleshing that out, just very roughly speaking at this point, thinking about maybe a 3-year trial. But basically, I just want the committee to know that is under discussion. Right now, we've got a very strong DuPageCRIS.org and helpline, but having a 2-on-1 would help expand the line from 7 p.m. to 7 a.m. It would add weekends, it would add holidays, and it would give an important extra layer of connectivity to residents who need things like rental assistance, senior services, food insecurity, and so many things that are so important to this committee. So hope it's something we can support. Like I said, we're fleshing it out, and we'll let you know. So I'd like to mention the DuPage Care Center Foundation golf event. Have you guys received anything through your emails? Okay, I'm not sure if they have all of us or not. Thursday, June 24th, Prairie Landing Golf Club, West Chicago. And who's in with me? I think I'm gonna do it, so it'll be fun. And also from the DuPage Care Center, they do anticipate having some board seats opening. So if you have someone to recommend, I know that they're looking for IT and computer help would be very much a plus for that board. And they are going to announce, I understand, in July that a good friend of many of ours, Irfan Ibrahim, will be joining that board. So anyway, that's all I have. And I will ask for a motion to approve the minutes of April 20th, 21.
So moved.
Committee. Second, anybody?
Second, Swarzy.
All right, thank you. Second, do we have any additions or changes to those minutes? Okay, roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Swarzy?
Aye.
Member Selman?
Aye.
And Chair Runningham?
Aye, those are approved. I'll take a motion to approve Community Services HHSR 26621, approval of DuPage County Ride DuPage program.
So moved.
Second.
All right, second. All right, do we have any discussion on this item? All right, roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Swarzy?
Aye.
Member Selman?
Aye.
Chair Runningham?
Aye. That's approved. I'll take a motion on HHSP 104-21, a contract purchase order with McKesson Medical Surgical Government Solutions to deliver incontinent products for the Care Center, June 1, 2021 to May 31st, 2022, not to exceed $195,000 per bid.
So moved.
Second.
And any questions, comments on this item?
Madam Chair.
Yes.
Thank you. I do have a question about this. How does this item sync with 9A? So 9A is a decrease in encumbrance of $66,518, and this is approval of a contract for $195,000. How, same company, same item. How do those two items sync together?
I'm not sure if anyone's on from purchasing or if Christine is, but I know they had a change in name. So we had to shift things around and reinstitute a new contract just because they changed their name. So I think we reduced the old and implemented a new with the new name.
That is correct. That is correct.
Yep.
So 66,518 over here in 9A. So that was what was left of that old contract?
Yes. I'm sorry, Janelle. This is Christine. Hi, everybody.
Hi.
On that contract, procurement had suggested that we decrease. That contract is still going on. So it looks like it's a decrease, but we're actually moving it to another contract because we still have time on this for the current incontinent product. And then we're taking forth the new incontinent product moving forward. So there's different times. We're just moving money from one contract to another. And then we're also taking the renewal that starts in June.
With the same company?
Yes, correct.
So 2 contracts with the same company?
It's a renewal. The contract for the consent agenda, that item procurement, they had a name change. So with that name change, we had to take the money that was in that contract and we had to close it out so they can make a new contract. So it's more of just letting you know that we're moving money. That contract is still valid till May 31st. But it looks weird, but we're also taking the renewal that's effective June 1st.
All right, thank you so much.
You're welcome.
Does that answer your question?
It does, thank you.
Okay. Any other questions, comments on this item? Okay, well, I'll take a motion. Did we already do that?
Yes.
All right, we have a second, so let's do a roll call vote, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. That's approved. I'll take a motion HHSP 10521, contract with United Pharmacy Staffing for supplemental staffing for the pharmacy at the DuPage Care Center, May 14, 2021 through May 13, 2022, not to exceed 50,000.
Second.
Thank you. Questions, comments here? Roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. Thank you. That's approved. I'll take a motion on HHSP 10821, contract with Amira Source Bergen Drug Corporation for pharmaceuticals for the inpatient outpatient pharmacy services at the Care Center, June 25th, 2021 through June 24th, 2022, not to exceed $2.4 million per renewal option. So moved.
Second.
Thank you. Questions on this item? Comments? Roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. Thank you. That's approved. I'll take a motion HHSP 10921, Cisco Chicago Inc. for primary food supplies and chemicals for the Care Center and JTK Administration and Judicial Office Facility, June 1st, 2021 through May 31st, 2022, not to exceed $1,152,570 per renewal.
So moved.
Second.
Second, thank you. Questions, comments? Roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. Thank you. That's approved. We have one DuPage Care Center request that requires parent committee approval. That's 2021-39 recommendation for a contract to Praxair distribution for oxygen, helium, carbon dioxide rental June 1st, 2021 through May 31st, 2023, not to exceed $22,332 per lowest.
So moved to start.
Second.
Thank you. Questions, comments? Roll call, please.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Member Chaplin?
Aye.
Chair Renahan?
Aye. That's approved. We have one budget transfer, 2021-410, DuPage Care Center, transferring to cover supplemental staffing for pharmacy, $50,000.
So moved.
Second.
Second, thank you, Member Shorzy. Questions, comments? All right, roll call, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye, thank you, that's approved. I'll take a motion to combine consent items A, B, C, D, E, F, G, H, I. We have largely health Healthy Air Heating and Air. We've met McKesson Medical and Chicago United Industries Appliance Carpet Parts. Motion to combine, please.
So moved.
Second.
Second to start.
Thank you. Roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. Thank you. Those are combined. I'll take a motion to approve consent items A, B, C, D, E, F, G, H, and I.
So moved.
Second to start.
Thank you. Questions, comments? Roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. Those are approved. I'll take a motion to combine informational items A, B, C, D, and E. We've got a July HEAP, HHS and state grant, and the state supplemental and continuum of care items.
So moved.
Second.
Second, thank you. Questions on combining these items? Roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
And Chair Renahan.
Aye. Thank you. Those are combined. I'll take a motion to receive and place on file informational items 10, A, B, C, D, and E.
So moved.
Second.
Questions, comments on these items? Roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. All right, those are received and placed on file. We've got 3 residency waivers. Is that right, Janelle?
That's correct.
3. Okay, did you want to start off by saying something about them, or how did you want to proceed?
I certainly will, yes. So just as a reminder, residents that do not live within the county that are looking for long-term placement, we bring before this committee. Our goal is to talk about these potential applicants and to ensure that we would not be displacing any DuPage County applicant over and above and out of county applicant. So currently we have 10 male beds, 19 female beds. We already have one of these beds offered to an in DuPage County resident. So no DuPage County residents would be displaced by these applicants. And then I will proceed to present the 3 unless someone has questions.
Any questions? All right, go ahead, Janelle.
The first, number 1 and number 2 are a husband and wife, male and female. Gentlemen, I'll just kind of combine them because it's the same story with the same family. So the husband and wife are currently in an assisted living and they're declining beyond the care that can be provided in that environment. So the children are really hoping that they can come here, be together. So 5 of the couple's 8 children currently live in DuPage. They still are able to recognize each other, love each other. So we will be happy to, and we're very fortunate that we have the capacity to put them together. So asking for permission to accept number 1 and 2.
Okay, do we
I'll make a motion to accept residency waivers number 1 and 2.
Thank you. Do we have a second?
Second, Salmon.
Thank you, Member Selman. Any conversation or discussion on this? Well, I'm glad that we can fill some beds, and I think, you know, this seems like a very happy story. So,
Right.
All right, roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Renahan.
Aye. That's approved. Moving on to number 3, Janelle.
Yes, so we have a female that's currently here under a subacute stay. Her permanent residence is in assisted living, and again, she's declined beyond that ability to stay there. So she's looking for long-term placement when her subacute rehab completes. She has earned a degree at Elmhurst College, raised her family in DuPage, and her son worked at the clerk's office for 34 plus years, and her husband also worked for the Board of Elections for 10. So we're asking for permission to accept our applicant number 3.
I will move to accept applicant number 3 to the Care Center.
Second, Dessert.
Any conversation here? Well, I'm glad that we can support former employees and people that have lived here so much. So thank you for bringing this forward. Roll call, please.
Member Chaplin.
Aye.
Member Dessert.
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Renahan?
Aye. All right, thank you. Those are all approved. Janelle, do you have a care center update for us?
I do have, I think I communicated in the past that we had some lab results that were positive that my director of nursing really probed the lab to look at, and they reran and they were negative. And so they identified some of their equipment. So in late April, we had another positive staff member. We went through the same exercise and they were indeed positive, even though they'd been vaccinated. So it looks like it was likely a variant, although the lab cannot give us specifics. They apparently send that information off to IDPH for further testing. So I'm not sure if we get any additional feedback from that, but we are required to do one round of testing, which has all been completed, and everyone was negative. This person did not work in a patient care area. So we were able to restart our visits again, so our families and residents can spend that time together. We've got recent CMS and CDC guidance about changing and somewhat opening our visitation. We're excited about that. We met and tried to prepare a plan, but we have to wait for IDPH's interpretation. So we're hoping this Friday we will get that, and then we can give a little more freedom to the visitation. Right now it's very structured, it's very labor intensive with coordinating. Phenomenal team, the social service, rec, everyone who volunteers. We're doing 30 visits a day. And that is an immense amount of orchestrating and structure and getting that all coordinated. So they've done an awesome job. So we're hoping that we can free up some of that and people can just come and get their loved one, take them for a walk outside, you know, and have a little more freedom with that. So hopefully that'll come Friday and I'll be able to share more good news on visitation next week or 2 weeks.
Great progress. Any questions from the committee? All right. Great. Thanks so much, Janelle.
Thank you.
Moving on to community services update, Carrie Keating.
Good morning. Couple things. First, I just want to congratulate Giving DuPage, Bali, and the entire Giving DuPage board. Giving DuPage Days. There were 2,851 individual donors who participated, supporting 103 nonprofit agencies. Their goal was to raise $300,000, and they raised $389,000, $389.77. So just a tremendous job that they did, considering it was a 5-day period. This is the second year of Giving DuPage Days. Last year it was a full month, and they raised, I think, about $225,000. This year in 5 days, they raised nearly $400,000. So they did a great job. Their social media campaign was really good. There was so many agencies that were participating. It was really exciting. So congratulations to Giving DuPage. What I want to focus the majority of my update on is the big exciting news from IDA yesterday that they've announced the date that the rental assistance portal will be opening. So the portal will open on May 17th. I'll give you an overview of what the program entails, and then talk about kind of our outreach and how we're going to be working on getting the word out. So the program will provide up to 15 months of rental assistance. So it's up to 12 months of arrearages and up to 3 months of advance rent. The maximum amount any individual household can receive is $25,000. And the payments will always go to the landlord. The eligibility requirements are the household has to meet all of these requirements. They have to be behind on their rent by at least 30 days. And I see you all taking notes. This is all on both the IDA website, and the county has a website as well. So, and I can send you the link to this after the meeting. So they have to be behind on the rent for at least 30 days. Obviously live in Illinois, and the rental property has to be their primary residence. 80% or below of the area median income. Experienced some sort of financial hardship, either directly or indirectly due to COVID. So obvious things like being laid off, or their place of employment was closed, reducing hours, have to stay home because kids are in remote working, so remote learning. So a lot of those, like I said, either direct or indirect impact. The documentation required, the landlord actually starts the application. So the landlord has to provide evidence of the past due rent. Usually there's some sort of ledger book or rent rolls or some documentation that the rent is past due. The landlord has to provide either a property tax bill or a monthly mortgage statement, sort of proving that they own the property, their bank information, employer ID number, and then a copy of the lease if one is available. It's not a requirement. And then a valid email address. The tenant will then receive an email that indicates that they need to go onto the portal and complete their portion. The tenant has to provide some type of government issued photo ID. There's not a specificity that it be an Illinois driver's license, it could be a passport, but some government issued ID. A utility bill or proof of address if it's different than what's on the ID that they provide. The amount of the rent and what's past due. Their 2020 household income, that's how that 80% of area median will be determined. A valid email address, and a very important note is that immigration status is not any kind of a factor. The tenant doesn't have to provide a social security number. So the I hate that. The page when you can't lick your finger. So we have a meeting this afternoon with Joan Olson and the communications team, as well as folks from our team. We have a meeting with the IDA marketing staff. We've been meeting with them all along, but just to make sure that we're coordinating on our outreach, that we're covering all of our bases. There's a webinar tomorrow and next Tuesday for nonprofit organizations that want to help, or really to anyone who wants to walk through the application and to be able to provide support to individuals who are applying. So we've put information about those webinars out to our continuum of care agencies, that's really all the agencies that provide rental assistance or any kind of housing assistance. So we anticipate there will be a lot of DuPage agencies that will join one of those webinars. In terms of our outreach, we will be providing electronic outreach, obviously through the county website. We've already emailed 550 property managers and or tenants who we've had contact with in the past year or so. Any tenant who has called about rental assistance over the past 3 months, we've taken their information, told them the IDA program is coming. So 550 folks were notified of that yesterday. We're going to be working with the DHA to make sure that they send something out to all of the landlords that they have connections to. We've been in discussion with the eviction court mediation program that they're getting up and running. And so the attorneys who actually represent landlords are very interested in hearing about this, and they want to get the information out. So we'll be sending that out to the eviction court attorneys. Municipal contacts through our communications team, as well as obviously all kinds of media outlets. It's sort of one of the things we want to make sure that we're coordinating with IDA, because it is a statewide program and we're sort of piggybacking onto it. We do have marketing materials that are co-branded with IDA and DuPage County, so it's clear that this is a county program as well. We'll be working with the Regional Office of Education, getting information out to the schools, really hoping to get it in the hands of school social workers who work with so many families that are at risk of homelessness. All of the food pantries will be getting emails from us, and obviously, you know, social media through the county's website or the county's social media accounts, as well as our own community services account. In terms of printed materials, we will have postcards, flyers, and a trifold brochure. All of those are in both English and Spanish. IDA is also committed to translating the the frequently asked questions, the FAQs, in multiple languages. So that will be available on the IDA website as well as the county website. We worked with the treasurer's office. They've identified all properties in DuPage County where the tax bill goes to a different address than the property address, and that does not have the homestead exemption. Probably a proxy for single-family homes that are being rented by others. So we're going to send a postcard both to the property address and to the tax bill address to try and get at individuals who may be renting out a home. We're going to be working with the state to see if we can get a mailing address, or either email addresses or a mailing address for anyone who's applied for LIHEAP. Because we're really under contract with the state to run the LIHEAP program, we don't own the data that's in their database. So we're hoping that they'll be able to give us a mailing that we can send out to. So in order to be eligible for LIHEAP, you have to be under 150% of poverty, and you have to be a renter. And so we're pretty sure that many of those folks would be right in that target group that we want to work with. I think that's it. Just a couple of other things we're working on.
Yeah, they're coming. Someone's got their Zoom open and their feedback.
Movie theater.
Yeah. Dolby's around some. Just a couple other things that we're working on in the world of housing. Joan Fox from our staff has been attending the eviction court remotely, because they're doing a portion of it via Zoom, just to kind of get a feel for how can we better connect with tenants that are in eviction court. We'd like to be able to throw some staffing resources at getting people connected. But the kind of working out the details of what is the process, how, when's the best time to try and intervene, how do we connect to those tenants. So she's been working on that. We're continuing to assist with hotel stays with CADS, Catholic Charities, and Metropolitan Family Services. They do, as well as 360 Youth Services, who's doing hotels for the first time. They've never done any kind of model like that before. PADS has told us that the health department has advised them to anticipate being in hotels and not having any capacity to return to any congregate shelter until at least October. The Community Development Block Grant Coronavirus Relief Funds that we've just brought through CDC and through this group, as well as County Board, does provide us additional funding for legal assistance for folks who are in a housing crisis. And then finally, we got the letter notifying us that we'll be getting just over $6 million in home funding. That's the fund that is typically used for the acquisition, rehab, or construction of affordable housing. There was and we usually get about 1.6 million a year. There was a large allocation of home funds in the American Rescue Plan that also opened up a new eligibility category, two new eligibility categories. One is housing stability services, that's kind of case management. And the other is the acquisition of non-congregate shelters, which basically means hotels, that can then be either converted into long-term affordable housing, they can be converted into congregate shelters, or they can be maintained as non-congregate shelters. So we were notified that we're getting these funds, but HUD staff have advised that so they have to go through a whole new rulemaking process because there are new eligible activities. So they don't anticipate the rules for this funding coming out until sometime in the fall, probably September or October, which means we won't really have a solid handle on exactly what we can do with these funds until that time. Then we'll have to go through a process of figuring out of those categories, which, what do we want to pursue? So so that is a large chunk of funding that's coming for affordable housing, but we are kind of a wait and see for the next, at least, I guess that's probably about 6 months before we know for sure what we can do with it. So those are my housing updates. Anybody have any questions on any of them?
Just a comment.
Oh, go ahead. Sorry. I was very tall on people too. Take it away.
Thank you, Chair Brennan. Just a comment, Mary, with the rental assistance. Wow, you guys really did a thorough job. I think I'm contacting every outreach that you can to try to find these renters. I think that the program is going to be really successful. So great job on that.
Yeah, we're trying to think of every avenue we possibly.
I mean, you really did. Yeah, really nice work on that. I'm excited for this program to start. I think it's going to help a lot of families.
Thank you.
Member Selman, you had your hand up. Go ahead, please.
Thank you, Chair Renahan. I was just wondering how the integration is going with the eviction court. Are we able to get those resources to, I know the money goes to the landlords, but are we having good success keeping people in their homes currently?
Not as much as we would like. We're having difficulty, and that's why Joan has started actually attending, to try and figure out what the process is. For quite a while now, we've been actually just doing a mailing to individuals who are defendants in eviction court. But they're not necessarily returning our calls. One of the things that we do know is that when people are in crisis, they stop opening their mail. So that's a very common, thing. So we currently don't have a really great ability to reach out early in the process. When we do, we're able to be successful fairly often. That we can find some sort of funding to assist to prevent homelessness. So we are working on it. I think is Joan Fox on? Joan?
Let me check.
Yeah, I'm here, Mary.
Yeah, she's here.
Yes.
Joan, did you want to comment at all on sort of how we've been doing with eviction and what we think we can improve on?
Yeah, I think that it's been very useful to attend the court, and things move very fast, and sometimes it's just very useful to be at court, to have a presence, and working with the courts to make sure that we can reach out to the tenants, because we often have the defendants, the plaintiffs' email addresses or their mailing addresses, but we don't have the tenants' contact information. So if we could reach out to the tenants directly, we'll do a better job.
And are we thinking that tenants just aren't being responsive because they're sort of afraid there's a bill at the end they're not going to be able to pay? Is that what we're thinking?
I think so, yes. And with the eviction moratorium, there's some protections. So I think it's a little bit of like, if I don't say anything, I'm probably better. So if we can reach out to people and engage them in this process, it would be much better. Attending court is very useful. Judge McCluskey has been amazing and welcoming in our court. So it's very good.
Awesome. I think if there's any messaging that it would be helpful for county board members to be pushing on social media that this isn't a trap, like we're inviting you to come to these processes and there's funds to make sure you can stay in your homes. Any of that sort of messaging that we can help put out, I think would be really helpful. I know especially in the last 12, 13 years, just the category of renting has increased exponentially, especially in the suburbs. So yes, to do everything we can to keep renters in their homes during these crazy times, I think is very good work. So thank you, Joan, and thank you, Mary, for everything you're doing.
Thanks for your interest.
In the room, I have Member Garcia and then Member Schwarzy.
Yeah, and I might have missed this, Mary. Are there going to be flyers being handed out, like food pantries and things like that?
Yeah, we have a one-page, like I said, we have postcards that we'll mail out. We have a one-pager that's in English on one side and Spanish on the other. Okay. And then there's a trifold brochure that has a lot more information. So yeah, one of the things that we want to talk with Ida about is those things have gone to print. We want to figure out what's the timing on when are we actually going to have them in our hands.
Yeah, I think
so we can email them out so that agents, maybe smaller food pantries can print them off themselves. Right. But an organization like Loaves and Fishes, they want, I think, 5,000 of them. So yeah, that's the idea, is to put them in food boxes to make sure that folks who are coming to food pantries are well aware of it.
Perfect. Thank you so much.
Great. Vice Chair Schwarzy.
Thank you very much, Chairwoman Renahan. Mary, the part that's a little confusing, maybe a little confusing to me, or maybe I think it might be confusing to the public, is the 80% median income. Because a lot of this is based on the fact that people lost their jobs that may not really normally fall into that category. Is that something you think that needs to be addressed as far as just making sure everyone understands how this works?
Well, both the county website and the IDA information have listed what your 2020 income would be to be at 80% or below. So yeah, many folks who normally would not have been in that category were in that category in 2020.
So is it based, I'm sorry, is it strictly based on 2020 salary? If someone lost their job, say in February of this month and maybe hasn't been able to pay their April bill and moving forward, will have that same issues. Is that something that they would be eligible as well?
Well, certainly the easiest way to determine eligibility is to look at your 2020 tax return, which most people should have completed by the time the 17th rolls around, because I think that is the new day that tax returns are due. That is a question that I've put to IDA for individuals who are, maybe were impacted in January or February of this year. So 2020, they did okay, but now they've lost their job. I haven't gotten a response from them on that yet, but I do think the majority of the economic impact did occur during 2020. I don't know that there's as many people who were not impacted at all in 2020, but who were impacted in 2021. So
yeah, that makes sense.
Yeah. So, and just the 80% requirement is part of the legislation. There's also in the legislation a requirement that prioritization be given to individuals who are below 50% of median or who have been unemployed for more than 90 days. So those applications will kind of get fast tracked.
Oh, great.
And they'll get assistance first, and then assuming there's additional funding for folks between 50 and 80, then there'll be the second wave of assistance.
Thank you very much.
Sure. Great.
I think
Joan wants to say.
If I can add, those calculations of 80% of your income are definitely confusing, and it was really important for us when we worked with IDA to get the table right there front and center in all the materials, so that you don't have to sit and try to figure out if you meet the requirement. And I just asked IDA, and I just received it, for the table to be put on our webpage. And one thing I want you all to write down and remember, May 17th, there's nothing more frustrating than telling people they can apply for something and it's not ready to be applied for yet. The link's not open. So we're going to be really thoughtful about how we launch this, because I don't want to tell people they can apply, but we have been doing a lot of pre-work with the providers that Mary's been talking to, informing landlords about the paperwork they'll have to start getting together. That's work we can be doing now. Public launch, I don't want to do until there's a link ready that people can go and apply for, and that they can take action immediately, because I'm still getting calls, and I'm sure you all are, for people looking for small business relief grant programs. And when the program's not active, I think that just tends to add to a lot of frustration for people. And we really don't want that. We want people to be able to get on, apply, and be very successful in their action.
Okay. Thank you, Joan, for your work with Mary here. I mean, I think the word comprehensive doesn't even cover what looks like what's been doing. I've had the best juggler I've seen in a long time. Great. I did go on the website yesterday. I saw that it had opened, and you're right. Currently it says check back for more information.
I find that really frustrating.
Yeah, no, I mean, I was frustrated too, because I was looking for kind of Mary's rollout that she was, giving. But at any rate, thanks to our committee for, I know we all care about the same things, and Mary, thanks for all you do. And so with that, I will move on to old business. Do we have any old business? All right, do we have any new business? All right, seeing no new business, I think we need to take I need a motion to adjourn. So moved. All right, thank you. Do you have a second? You guys want to stay here? Can we get a second?
Second, Salmon.
All right, Salmon, thank you. Roll call, please.
Okay, Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Salmon.
Aye.
Member Chaplin. Member Dessart. And Chair Renahan.
All right, yes, thank you. Thanks, everyone.
Bye-bye.